Hi there, my name's Alexandra Parsons. Within the perioperative environment, there are many hazards posing a risk to both the patient as well as the surgical team. Therefore, it is vital that the perioperative team have knowledge of the equipment and hazardous factors within the surgical environment that cause potential harm. As discussed by Nancymarie Phillips, injuries may result in faulty equipment, the incorrect use of equipment, and exposure to toxic or irritating agents, for example, radiation and laser. Radiation and laser may be used in the forms of fluoroscopy, the usage of laser scalpels for cutting and ablating living biological tissue, laser therapy for the treatment of cancer, laser heat to clean or sterilise the edges of body tissue to reduce infection. There are recommended standards, guidelines and recommended practices that have been developed by many professional associations, such as the Association of Perioperative Nurses. The nurse should become familiar with these guidelines for best practice implementation within a continuously changing environment. So what is it? Ionizing radiation has been classified as a carcinogen by the World Health Organization. Radiation types within the ionizing radiation range have enough energy to remove electrons from atoms. Gamma rays and X-rays fall within the range of ionizing radiation. Equal doses of different types of energies of radiation cause varying biological effects in different tissues. So what does it cause? As further discussed by Nancymarie Phillips, exposure to radiation can cause cancer, cataracts, bone marrow injury, burns, tissue necrosis, genetic mutations, spontaneous abortion, and congenital abnormalities. One study by Srinivasan states that the use of lead aprons and thyroid shields reduce effective dose by several orders of magnitude. Proper operator positioning also minimises radiation exposure, and lead gloves decrease dose to the surgeon's hand from scatter radiation if the hand is out of the X-ray beam most of the time. This emphasises the importance of protective shields within the operating theatre and not taking shortcuts in a time-driven environment due to high-risk procedures and potential harm. The nurse is able to ensure protective clothing is available and ready, especially on lengthy procedures which may result in human error due to exhaustion, such as forgetting to put on a piece of equipment or shield. This also refers to patient safety and preparation. Furthermore, Phillips and Weerakkody discuss methods which can be implemented by the perioperative nurse, such as actively referring or searching for signs of radiation-induced skin damage as part of a routine follow-up or included in patient handover to the ward nurse, especially in patients of long and complex procedures, ensure machinery is turned off when not in use, advocate for a rotation of tasks with team members, especially within procedures that involve radiation, and ensure radioactive elements remain in a lead-lined container until ready for implantation. The scrub nurse can put a sterile drape over the screen when preparing radioactive implants and reconcile incorrect instruments. Ensure the availability of portable lead shields to avoid scatter radiation, and also ensure that shields are stored correctly and not folded, especially pieces of clothing, resulting in damage to the safety of equipment. Thank you.